Hello, everyone. I'm Hal Eisner. While in many corners there's an excitement at the idea of California opening up again, there's also a level of stress involved. It's going to take a while for some people to adjust to being around crowds again. And there are those who just simply don't want to take the plunge. Joining us right now to talk about all of this is psychiatrist Dr. Carole Lieberman. And Doctor, how you doing? Good to see you again.
Fine, thank you. Great to see you.
Thank you very much. You're hearing the same chatter that I'm hearing out there on the streets, that some people are all excited about getting back to life again, and some people are kind of shy about it. First of all, what's your thought about that?
Well, yes. The people who are shy about it, who have some reluctance, don't feel they're keeping it a secret to themselves because we feel like we're supposed to be all excited and just rushing out the door. But I have developed called something reluctant reentry syndrome, which has 10 symptoms, and I think a lot of people can relate to that.
All right, let's talk about that. First of all, let's break them up a little bit here, and let's talk about what you think the bottom 5 are, and let's work our way to the top 5, okay, very quickly. What are some of these 10 items?
Sure. Well, one of them is agoraphobia. Agoraphobia is literally fear of the marketplace, and that existed before COVID and before lockdowns. But now when we go out into crowds where you're so used to being isolated that we're fearful that we're going to be swallowed up by them. Another one is this is a reasonable one, fear of catching COVID-19 because of new strains, dreading the awkwardness of reconnecting with friends and families and coworkers. It's like being the new kid in school. We all feel like the new kid. Then no longer having the excuse of not having a partner due to COVID, blaming COVID and isolation for that. Guilt over releasing your kids back into the scary world because no one is really sure about that. And then one that really is, it's a feeling that we're having, but it's a possibility. It's a good opportunity. And that is realizing that we don't have to go back to our old life, but some people are not sure how to reinvent themselves. But this is a great opportunity. We have been forced to separate from our regular life, our old life, and now we can really start anew. Think about which things are important to us. What do we want to continue? Which friends? Which job? Where do we want to live? It's like being born again.
It's like being born again, or somebody told me the other day, it's like coming out of hibernation. It's like coming out of hibernation. But there are people I've talked to in this past week that are feeling this sense of anxiety. I want you to listen to somebody right now, and let's talk about this right after we hear from this man.
I'll play it safe for a long time until, the CDC comes out and says, you don't have 6-foot distance anymore, but I'm sure that'll be a while.
Might be a while. Things are kind of in motion at the moment. But, there is that kind of built-up concern. And one thing I wanted to find out from you, there are transitions. The transition from before pandemic into pandemic was one thing we all had to kind of get our head around. Now we're going to go from pandemic to post-pandemic, which is harder.
Well, in a way, this is harder going into post-pandemic because, as much as we hated, most of us, being in lockdown, there were some rules that we, felt we weren't given a choice. Now there are no rules, and each of us has to decide for ourselves. And so that does make it harder. Plus the confusion, like what that man was saying, we don't really know. There are so many different conflicting pieces of advice as to what's safe and what isn't, that's a big part of it.
So let me ask you, what's your advice to anybody that's out there who might be going, well, yeah, it's going to be nice to have the economy reopen. I think I might just want to sit this one out for a few days.
Yeah, I think everybody wants to kind of watch other people do it. I think the thing is, there's the analogy of jumping into the water, or holding on to the side of the pool. When you jump into the water, it does feel there's a shock. It feels freezing oftentimes right away, but then gradually your body gets used to it. Well, I think it's very similar now that it is going to be a shock going back out there full force, but then we're going to gradually get used to it and remember how wonderful it is to get hugs from people if you feel safe to do that, and just be close to them emotionally, chat with them.
For a long time, we didn't know whether to do elbow bumps, fist bumps, foot bumps, or even handshakes. Now we're going to get back to, well, wait, what do we do now?
Yes, exactly. And the bottom line is everybody has to decide what they're comfortable with. And of course, what the other person who you're doing whatever that is with is comfortable with.
But the notion of somebody who might really be uncomfortable, I mean, really seriously uncomfortable, that they just don't want to take a chance. They don't want to put that toe in the swimming pool. They don't want to know if the water is cold. Is that a good idea to just kind of like stay back?
Well, it's everybody, you have to be very patient with yourself. If you really feel that you want to stay back for as long as, that takes, I mean, I think as long as, of course, for some people, some jobs are making people return now. Some people don't necessarily have much of a choice if they want to keep their job. But I think you don't have to do what your neighbor is doing or your friend is doing. Decide what's comfortable for yourself and gradually walk back out there.
Well, the bottom line here is that whether it's children, grown-ups, grandparents, we're all about to face a new normal. Is that kind of the bottom line? And we have less than a half a minute. Why don't you just kind of wrap it up?
Okay, sure. And a lot of us, don't want to get out of our comfy pajamas, or we're fat and furry and we don't want people to see us the way we look now. It's all of these kinds of things. Also fear of missing out. We have the pressure of that again. But just be patient with yourself. You just do whatever feels right to you. And again, really, the opportunity to reinvent yourself is something to take very seriously and decide what it is you want to keep and what you want to toss away in your new life. But
in a way, I want to end this on kind of an up note, because what an exciting opportunity. I mean, we have been sitting in this rabbit hole for 15 months, and now we get a chance to look out and see the sunshine. What a great opportunity. Carole Lieberman, thanks so much for joining us. Always good to talk to you.